Hello, good morning. I'm Deirdre Coyne, and today I am talking about why mental health matters. Today is World Mental Health Day, the 10th of October. This is a day for global mental health education, awareness, and creating an advocacy around social stigma. So it's been going since 1992, and it was an initiative of the World Federation for Mental Health. And why is it important? Well, if I could um, if I could compare it to our physical health and how we ensure that our physical health, because we need to make sure our physical health is good. So we do a lot of things, hopefully, to perhaps eat better, to exercise, to do all the things that help us to be at our best physically. But how much do we invest in our mental health? And if we can, and there's a lot of evidence around the ways that our body and our mind are connected. There's a lot of information around the gut and how the vagus nerves connect and how what we eat affects how we feel, but also how what we think affects how we feel. And as a cognitive behavioral therapist, that's one of the core um, messages, I guess, is that how we think affects how we feel, but also how what we do affects how we feel. So what we're doing makes a difference, and what we're thinking makes a difference to us being at our best. So performance wise, our mental health matters. So what can we do? Well, one of the greatest assets that we have as humans is our social connection, so our tribe. So talking about mental health to others. So the caption or phrase or quote that's used around mental health is that it's okay not to be okay. So when we ask somebody, how are you doing? How are you feeling? We generally say the person will say, I'm okay, fine, everything's fine, when it isn't. And we miss that opportunity. So kind of practicing talking more about our mental health and saying, I'm not okay, I'm feeling anxious, I'm not okay, I'm feeling down or depressed, um, is the key to starting that connection and starting that conversation. And the most important part is just getting started, removing the stigma around mental health and talking about mental health and making it as easy a conversation around physical health. So we talk about physical health a lot. We talk about, perhaps the measurements that we use for physical health might be our weight or um, different things that we're doing or how we're training. We're doing running, walking, whatever your exercise is. We talk about that. We talk about it freely. Some of those techniques can be used to improve our mental health. So what we eat affects how we feel in our mind, and also movement is a great um, source of goodness for our mental health. So it's just finding what works for you, getting bespoke about your mental health, talking about it, normalizing it. Um, and I hope that that then will help to improve all our mental health to just start talking about it. Thank you for listening to me today, and I hope this was helpful. Have a great day. Bye.